Hello, I'm Irvin Waller, and I'm very honored to be joining this important panel about this book on UN human rights and their implementation. My chapter is called Reducing Violent Crime by 50% before 2030, and the Decisive Action Now to Achieve SDG 16.1. In 1985, the world leaders resolved to prevent victimization and provide victims with rights. It was a very important General Assembly resolution that talked about adopting national measures, about implementing crime prevention policies, and so on. In 2015, the world leaders committed to well-managed action to achieve significant reductions in homicides and violence against women and children by 2030, the UN Sustainable Development Goals. Governments were to set measurable targets, to invest for results, to achieve outcomes, and to monitor performance. Unfortunately, today, those actions have not happened. The world still faces outrageous and inexcusable rates of homicides, common violence, and violence against women and children. In a year, 500,000 homicides, more than 25 million women will be raped, 1 billion children who will be victims of violence. This has to be stopped. In 2021, we know more about the impact of those tragedies on victims. We know cumulatively that amounts to trillions in US dollars in pain and lost quality of life. We know that victims are losing confidence in the police and the justice system and not reporting to it. We know that countries are losing GDP because of those levels of violence. In 2021, governments are still misspending on reaction instead of getting upstream and investing in prevention. They are overspending on outdated policing and prisons. There's been no shift to effective prevention, and there's more talk than spending on victim rights. In 2021, we have the evidence on what works to prevent crime and violence, both causes and solutions. So we need to use it. Yes, we can get it for North and South from the World Health Organization. They have a website. We can get it for the North from the US Department of Justice, its Crime Solutions website. Or you can get it more easily explained to you in my book on Science and Secrets of Ending Violent Crime that uses those sources and others, ECOSOC sources, the UN Habitat sources, and so on. We know in problem places that prevention works. We can outreach to excluded youth, as was done across the United Kingdom in the youth inclusion programs, or has been done by small projects called Cure Violence in high gun violence cities in the US and other countries. We can train youth to choose nonviolence. My favorite is Stop Now and Plan, a program developed in Canada. We can coach vulnerable parents on how to be more positive parents through the Positive Parenting Program. We know that in schools and universities, prevention works. We can teach life skills and nonviolent conflict resolution. We can teach healthy sexual relations like the fourth hour, another Canadian invention. We can get bystanders to intervene. Now, all of those and all of those that I talked about in relation to youth achieve a 50% better reduction in violence than the status quo. This is also true in the health sector, where outreach in hospital emergency rooms to victims can divert them from coming back as victims. We can focus on recovery from post-traumatic stress disorder for victims, one of the risk factors for victims to become offenders. And we can collect data using the WHO standards that we can use for epidemiological solutions to violence, as in the Cardiff model. These all reduce violence by 50% better than the status quo. Smart police services, so reorienting policing to be much more cost effective, putting victims at the zenith of policing so that they report and are treated decently, hiring more female officers or opening all female police stations, solving problems through problem-oriented policing, and focusing deterrence on well-known risk factors to violence: alcohol, knives, and guns. Now, there's cities that have cared about victims and engaged in comprehensive planning and succeeded also in getting 50% reduction, not just in projects, but across the city. Glasgow is my favorite for low violence countries, and its 50% reduction in 3 years after the analysis is being replicated across 18 regions of the United Kingdom, including London. Oakland is an example in the high gun violence cities in the United States that was successful in reducing violence. Bogota is the city to look at for Latin America and Africa, where there are unfortunately extraordinary high violence cities. But Bogota is not alone. Coahuila in Mexico and others have shown that 50% is possible. Now, what they did, other than have the political will to make it happen, was they established an office for crime prevention, or a violence reduction unit. They engaged the agencies able to tackle the causes. They mobilized the public, particularly mothers who can put pressure on offenders. And they planned, diagnosed, implemented, and evaluate the keys to successful implementation that are so consistent with SDG 17. Some countries have tried to establish national policies to care about victims by reducing victimization. And they have been trying to apply the keys to success, such as planning and training. They've been beginning to measure reductions, and they've been beginning to invest. But they are not doing enough, and they need political will and support to make sure that the funding is adequate and sustained, and those offices, national offices for violence prevention, are put into legislation and made permanent. And these are urgent, and these are actions that are affordable and are popular. Governments that have gone to elections with a policy of tough on causes, tough on crime, have been elected. In fact, prevention is more popular than more police and prisons. Social movements have taken to the streets in the last 10 years for lives to matter. And ending violence is a powerful way to increase GDP. And most low and middle income countries want to increase GDP. So what can the Kyoto Congress do to accelerate that overdue action to make lives matter, to achieve these SDGs? Well, they have to become pathfinders, governments, and they have to be pathfinders, and they have to help cities to be pathfinders. The UN agencies must work together. The World Bank, the Inter-American Development Bank must cooperate. They know that an investment in prevention is an investment not only in saving lives, but increasing GDP. And yes, we need faith-based organizations and civil society to raise awareness and to encourage governments to act and to become part of the solutions locally. There are 5 things that are really important. The first is we have to use what we know. That means getting to know it. That means using the essentials for success and using the logic. We know that we have to raise awareness among politicians and the public of those solutions using the media, the news media, television, radio, but particularly using social media that is so influential, and teaching these in schools. We have to foster the human talent, the capacity to implement this. We have to provide development for key decision makers, training courses for practitioners, and get this ingrained into university and college courses. We know we have to act locally because cities know where their problems are, but cities cannot do this alone. But they do need to diagnose and plan. They do need to mobilize the sectors, and they do need to be inspired by success. We need to work collaboratively across borders. We need to provide examples of successful policy proposals, to develop tools to monitor, measure, and share, and build the momentum to make lives matter. The Kyoto Congress must accelerate overdue action to make lives matter. Science, awareness, training, local collaboration. I'm Irvin Waller, a professor emeritus at the University of Ottawa. You can learn more from this chapter in this fantastic book, or more from my book, Science and Secrets for Ending Violent Crime. Thank you so much.